what I wanted to highlight was a recent executive order that was passed by the Trump administration to accelerate research into psychedelics for addiction and mental health disorders. I'm very excited by it because, on the one hand, we really need more emphasis and more dollars allocated to advancing addiction science and expanding the array of treatments that we have available for addiction as well as mental health disorders. But I also found that it highlighted for me what I think is an important tension, where on the one hand, there is this increasing awareness of addiction as a public health problem. There's greater willingness to talk about it and to really work on expanding solutions by studying innovative treatments and really driving that expansion with a sense of urgency. On the other hand, there is this sort of implicit assumption that the problem with addiction care today is that treatments are failing and that finding better treatments is the solution. And that is where the major misconception lies, because we actually have very efficacious evidence-based treatments for addiction. And the root of the problem for employers, for society, and really for public health as a whole is that they aren't being utilized. So we know that less than 10% of people in need of care for a substance use disorder actually receive that care. And that's the storyline that I think is getting missed.